Hi everyone, Dr. Vipul Shah, Clinical Director of PAC Health here with another COVID-19 update. I know it's been a little while since we've talked, so I hope everyone is staying safe and healthy. The main focus of today's episode is going to be on testing, and we have a great guest who's going to be talking to me. His name is Dr. Gandhi. He's an infectious disease doctor here. But before we get to that, I just wanted to talk a little bit about some of the things that are going on in the country right now. So obviously, COVID-19 has not gone away, and I think it's important that we all recognize that. And even though state and public health officials have different guidelines depending on where you are, I think obviously following their recommendations, but also thinking about what's best for you and your loved ones. So social distancing is still extremely important. So maintaining that 6-foot social distance whenever you're in public places. If you are going to be in public, wear a mask. I know there's a lot of conflicting information, but we know that masks are going to reduce the spread of the coronavirus. It may not be that you're just protecting yourself, but you're protecting your communities. So please, if you can, wear a mask. And then finally, continuing to wash your hands. Those are the things that we've been saying from the beginning, and they're the things that I think we're going to keep stressing throughout this pandemic. So I also know that there's a lot of other issues going on right now, and so making sure that as we do fight for equality and justice here, we are being safe while we're doing that. So if you are attending the demonstrations or part of the protests, make sure that you're wearing a mask during those times as well and trying to stay socially distant. This is obviously hard, I understand, but we want to be safe as we're also doing the other work we're trying to do as well. So without further ado, let's get to my interview with Dr. Gandhi. And once again, he is an infectious disease specialist here in Birmingham, and we were really excited to talk yesterday. So we're really lucky today to have Dr. Anurag Gandhi, who is an infectious disease specialist here in Birmingham, Alabama, here with us to talk a little bit about testing. So thank you for being here, Dr. Gandhi.
Thank you, Vipul, for having me. Happy to be here.
So let's just get right into it. So Dr. Gandhi, what are the types of COVID testing that are available right now?
So there are two types of COVID tests, and we'll keep it simple. There's one which is either a nasal or an oral swab, and that's a PCR test, so it tests the viral protein. And there is a second test, which is a blood test, which tests the antibodies for the COVID infection. Okay. So those are the only two tests that are available.
Okay, and who should get the PCR test, and who should be getting the antibody test?
So the PCR test is an active infection test. So folks who have a cough, sore throat, fevers, malaise, chills, body aches, they obviously know they've been exposed and they think they might have an active infection. I think those people should get a PCR test. And people who may have had an infection or who have had a previous COVID infection and want to know if they have developed an immune reaction or antibodies to those tests, they should get the antibody test.
Okay.
Or the blood test.
So this is just from an experience I had. You can sometimes get an antibody test at the same time you get the nasal swab. Is there a difference? So which one's more accurate at that time?
So from an accuracy standpoint, if you are doing a nasal swab test when you are having symptoms and it turns positive, I think that's what I would look for in terms of accuracy. An active infection with symptoms and you're doing a nasal swab, and that's a PCR test. So that's definitely more accurate. If you do an antibody test, sometimes it may be negative because you're doing it very close to an infection and you've not given your body a chance to develop the antibodies yet. So even if it's negative, it doesn't necessarily mean that you did not have the infection.
Right.
So that's why timing is important, and that's why I mean by one is an active infection test and one is to check if you've been exposed to it or had an infection a few weeks earlier.
Okay. And what about the overall accuracy of the tests? What do you think about the PCR accuracy, and what do you think about the accuracy of the antibody test for not whether you add it, but whether it's really going to pick it up or not?
So I think they're both fairly good tests, but from an accuracy standpoint with PCRs, we do understand that we miss a few. So somewhere in the ballpark of the 70%. So it's not a 100% accurate test, but I think it's a rather good test because if you have an active infection, it picks up the virus.
Okay.
From an antibody test, there are two kinds of antibodies. There is what's called an IgM, which is an antibody or blood test for a more recent or an active infection. And those typically pick up, they're pretty much 100% accurate tests.
Okay.
If you've got the COVID infection and you're trying to kind of find the acute antibody tests, they'll pick it up. The same with the IgG tests, which are the more prevalent and a lot more labs offer it. They're again a blood test. The IgG is the kind of antibody that they measure and pick up. And a large part of the labs now are very specific to the COVID infection. And so I would say they're actually, again, a fairly accurate, like 100% accurate in terms of specificity and sensitivity. So they are good tests to know if you've had the illness before.
Okay, that's good to know. In terms of the antibody test, and you said that it tells you whether you've had the infection before and whether your body has had the reaction. Does an antibody test mean that you're now immune to COVID-19?
So I think the word immune, it's interesting. I'm tempted to say yes, because you've been exposed to it, you have developed antibodies, and you should not get an infection again. Now, is that 100% guarantee that you will not get an infection again if you've again been exposed to, a large room with lots of COVID people, if you've been exposed many months later and you had an infection earlier and your antibodies or have kind of eventually gone down over time? It's a possibility. So the way I look at it is your chances that you will get a COVID infection if you have antibodies is much lower than if you don't.
Okay. And I guess the other question is, if you have these antibodies, based on what you're saying, you're maybe immune for some period of it. What do you think about masks during that time? Do you think that people should still always be wearing masks regardless?
Absolutely. I think if two things we know that do work, or actually three, it's masks, it's keeping a reasonable, as we say, 6 feet social distancing in large indoor groups, and hand washing, plenty of hand washing. I think these are three things I feel as a consistent message, irrespective of your antibody status, we need to maintain to be able to keep ourselves and the community safe.
Yeah, that's super helpful. So one thing that has been talked about is, as people get back to work or as places start opening up, that people might be getting tested more regularly. What do you foresee as like a normal testing schedule for people, or is that even going to exist? Or is it really just going to stay on a symptomatic basis? Because the question is, how often should people really be getting tested?
So I don't know that, this is going to be probably a work-specific requirement, but the way I think about it is, you get tested with a PCR if you're symptomatic, or if you've had an obvious exposure in your family, like you're a household contact, and a few days have passed, you're feeling uneasy whether you're got the infection or not, and so you get a PCR test.
Okay.
I'm not sure that doing a every 7-day or a 14-day PCR test to just find if you've had the virus is of any value, because PCR picks up an active infection, and if you're and mostly if this virus is present in you, it causes some symptoms.
Right.
People are different and they react differently, but it causes symptoms. The blood test, on the other hand, is something that is, being thought through, and different organizations, CDC, the state health, are all thinking about in what capacity to use this test. And so this test may be used periodically to know if in your cohort of or workforce or amongst healthcare workers, they've been exposed to this virus and have started to develop or have actually already developed antibodies, which kind of gives them some degree of protection from another infection. So this could be done as things are opening up and as many more people are coming into common work environment, I think maybe testing everybody to see what that level of exposure or partial immunity is. And I think it's not standardized, but it's definitely something that we should all think about.
Okay. And I guess to that end, that must mean that we have more tests available now, that if we could test people at that level, more tests are now available to actually do those tests. Is that true?
Well, that is correct. I think both from a PCR standpoint as well as from an antibody standpoint, which is the blood test, there are plenty of labs doing that.
Okay.
I do believe, just to tell all of you, there are very many different antibody tests. So I would urge anyone who's getting it to ask specifically if the antibody test is just for a coronavirus or is it specific for the COVID infection, because they are slightly different. Coronaviruses have existed for years and COVID is the new pandemic. So you want to know how specific your antibody test is.
So if you're going to go get an antibody test, you should say, I want the COVID
specific antibody test.
Okay, that's good to know as well. So I think one thing that's come out in the news, and just to kind of understand, a lot of people are saying that coronavirus cases are going up in different areas. You know, even here in Alabama, they continue to rise, and around the country, there's different hotspots opening up. One of the questions is this just mean that we're testing better, or is this really a surge in new cases as we are opening up? So we still need to really still be doing our social distancing, still be wearing our masks, still washing our hands. What are your thoughts on that?
So I want to answer this question as a two-part. The previous question that we just talked about, which is obviously there are more tests available, people are more aware, as time's gone by, more people are getting tested. I think that definitely contributes to having an increase. But I do believe that the larger part of the increase actually is that everything's opened up, a lot more people are interacting with each other, and probably a lot are not maintaining the safe distancing or are masking. And so in common areas, when people are not using the precautions, not only do they contract the illness, but they also have the ability to pass it on. And so I think we need to maintain our social distancing, we need to be masked, we need to hand wash, we need to avoid large gatherings with very close contact indoors. I mean, it's summer, be outdoors. Yeah. And try and, as they say, slow this rates as well as flatten the curves.
Yeah. Well, thank you so much, Dr. Gandhi. It was all really great information. We really appreciate you coming in and talking to us today.
Sure. Thank you much. Everybody be safe.
All right. Thank you.
All right. Bye-bye.
All right. Fist or elbow.
So I hope that gave everybody some good information. So once again, there's two different types of tests. The one that they stick in your nose called the PCR test, that's going to tell you whether you have the virus right now, or the antibody test. So that's a blood test that's going to tell you if you have had the virus in the past. They're used somewhat differently, and make sure that if you are getting tested, you know which one you're getting. So that's about it for our update this week. I hope everyone once again is staying healthy and safe and is figuring out their new normals here in the post-COVID-19 world, or not really even post, but inter-COVID-19 world. And once again, reach out to your health advisor if you need anything. Here at Pack Health, we really have a lot of great content if you have any questions about COVID-19, and we have a lot of great resources that we can help you with during this time. So we are here to help, and please reach out. All right, have a great week. Bye.